Hello, my name is Kapong Limson. I'm from the Harding College of Pharmacy, and I'm here to talk to you about colon cancer. Why colon cancer, you might ask? Colon cancer is the third leading cause of death from cancer in the United States, as well as the third most common cancer in the United States. So it's important that everyone know a little bit about colon cancer, especially who's at risk of colon cancer, how can you lower your risk of colon cancer, and what tests can you take to see if you have colon cancer. Generally, once you reach 50 years old, your risk of colon cancer increases greatly. So therefore, it's recommended by doctors that you get tested for colon cancer once you turn 50. You might need to get tested a little earlier if you have the three following risk factors. If you have a family history of colon cancer, if you've had colon cancer yourself, or you've had some form of chronic inflammatory bowel disease. That being said, you can lower your risk for colon cancer if you have a diet high in fiber, which comes from vegetables and fruit. The American Cancer Society recommends at least 5 servings a day of fruits and vegetables, some which are lined up here, such as the lettuce, the spinach, the bell peppers, the bananas, apples, and oranges, or food that are just high in fiber in general, like the flaxseed oil, the flax seeds, and the whole grain oats. You should also lower your intake of red meats and processed meats, such as the things that are found in fast food. And you should try to cut out alcohol if you can, or if you can't, limit them to 1 drink a day if you're a woman, and 2 drinks a day if you're a man. You should also try to exercise and decrease your weight if you're overweight, as generally healthier living in general will help you decrease your risk of colon cancer. And as far as tests goes, they could range from the simple, which is the fecal occult blood test, which all that is taking a sample of your stool, sending it to the lab, and the lab will get back to you to see if there's blood in your stool. If there is blood in your stool, it's a pretty good indicator of colon cancer, but it's not definitive. The other 2 tests are a little more involved, and they involve the doctor taking a look at your colon, which is pictured right here. This here is the end of your rectum, and you have 2 tests. One is called a sigmoidoscopy, and it involves the doctor taking a look from the end of your rectum all the way up to right here, which is the sigmoid colon. The complete colonoscopy is a little more in depth, in that it goes from the end of your colon, end of your rectum, all the way up inside you to over here, which is the beginning of your colon. Both these tests have a significant advantage over the fecal occult blood test, in that it doesn't just tell you if you might be at risk or might have colon cancer. It allows you to prevent colon cancer. Because if the doctors find anything in your colon while doing these 2 tests, they can literally cut it out before it becomes cancer, which is a great thing for preventing colon cancer. It's recommended you do the fecal occult blood test every 1 to 2 years after you turn 50, provided you don't have those 3 risk factors I mentioned earlier, or the sigmoidoscopy every 5 years, or the colonoscopy every 10 years, just to check up on you to see if you have any more abnormal growth or colon cancer developing. I hope this public service announcement has been informative for you. If you have any further questions, or if you think you might be at risk, or you just have some general concerns about colon cancer, please talk to your doctor. Have a nice day.